I'm Dr. Bruce Carlin. Welcome to Physician Focus with the Massachusetts Medical Society. In a previous program, we began a discussion on how food affects our health. This edition of Physician Focus will continue that conversation. We'll look at how we can become better informed about food and what eating healthy really means. We'll also get our experts' opinion on such topics as organic food, genetically modified organisms, and more. Our guests for this discussion are Dr. Edward Saltzman and Miss Amy Taitch. Dr. Saltzman is the Academic Dean for Education at the Tufts University Friedman School of Nutrition, Science, and Policy, where he is also an Associate Professor of Nutrition. He is also an Associate Professor of Medicine and Chief of the Division of Clinical Nutrition at Tufts Medical Center. Ms. Taitch is a registered dietitian and weight loss counselor in the Energy Metabolism Lab at the Jean Mayer U.S. Department of Agriculture Human Nutrition Research Center on Aging at Tufts University. Welcome back, Ed and Amy.
Great to be here again.
It's good to have you. Let's review the impact of food on our health. Can you take that, Ed?
Absolutely. Last show, we discussed how food can contribute to your body weight, your risk for chronic diseases such as heart disease, diabetes, arthritis, and finally, just how we feel. Food can affect our mood and how we feel about ourselves.
So at the end of the show, I was throwing out terms to you, and we were talking about what those buzzwords had in it for the public and getting some expert opinion on what they might be. We ended talking about sodium and its effect on our health. The new topic that I guess is really hot is potassium. Can you help us with, why don't you take that one first, Ed?
Sure. Just like sodium, potassium is a mineral, and potassium naturally occurs in foods such as fruit and vegetables. And it turns out that when we increase our potassium intake, our blood pressure can go down. So even if we didn't decrease our sodium, by consuming more potassium, it may have a beneficial effect on blood pressure. Of course, the best combination is probably to decrease sodium and increase potassium. And I think Amy can tell us about some of the more specific foods or types of foods where we can find potassium, and also where we can find guidance about potassium.
Sure. So potassium is in a lot of very nutritious foods. The biggest ones are fruits and vegetables. So most of us probably know bananas, and that definitely is a source of potassium, but you can also get it from Swiss chard, you can get it from oranges, from potatoes, from any kind of fruits and vegetables. So eat your fruits and vegetables. And if you really want to look at where potassium is, we talked last time about the nutrition facts label and how it should be changing. And since potassium is such a hot topic, they are adding it to the nutrition facts label, and you can see it's on the bottom now. And so if you're not quite sure what the potassium content of the food is, you can go ahead and take a look at that nutrition facts label on the food product and see how much potassium there is.
So I've got one of my friends who is now telling me that kale is the superfood, the mighty.
Sure, kale is a wonderful food. It's very nutrient dense, which means there's got a lot of nutrition packed into it. So it's definitely a great choice. At the same time, too much of a good thing is not a good thing. So kale is a great food, but you want to try to make sure you eat a variety of fruits and vegetables. And as I like to say, eat from the rainbow. So eat from a lot of different colors can be very helpful.
And I would just add that superfoods, or highly nutritious foods, such as kale or blue-green algae, which some people are consuming, or even quinoa, which is the way it's spelled, looks like quinoa. People are calling that a superfood. I would just add that consuming those nutrient-rich foods is a great idea. However, they don't make up for a diet that has a number of bad choices. They contribute to an overall healthy, balanced diet, but we can't just have one or two superfoods and have a really crummy diet the rest of the time.
So in other words, if I eat a piece of kale, it doesn't cover up for the donut?
Something
Right.
like that, yeah.
Right, and you
Yeah.
can't just eat kale. You have to
Yeah.
definitely eat a balanced diet.
The rainbow again.
The rainbow colors, yep, and really making sure that you try to get foods from all food groups.
Well, we've been seeing a recurring theme here from you, which is to balance a bunch of foods that both have been talking about. You're not just eating one thing. So let's talk about some diets that people do. What about vegan versus vegetarian?
Sure. So the vegan diet means there's no animal products in there whatsoever. And that's a lot of people have different reasons why they choose it. A vegan diet it's quite difficult to actually to follow a very
Achieve,
balanced
yeah.
diet. And most people sometimes will eat too many of one food group and they're actually deficient in something. So if you are doing a vegan diet, I would recommend making sure that you do your research, talk to a dietitian, talk to a doctor, and kind of make sure that you are eating a balanced diet. Now, a vegetarian diet, you definitely can eat the proper amount of nutrients. Again, it will take more work than a normal diet that does include meat, but it is possible. And typically with the vegetarian diet, depending on what kind you are, so you could be a pesco-vegetarian and therefore you will eat fish, or you can be a lacto-ovo and then you would eat the dairy
Milk products,
and
yeah.
exactly and eggs. So it does definitely vary, but you want to make sure you consume beans and foods that are going to actually contain some protein and still following that balanced diet.
One thing about the vegetarian diet as opposed to the complete vegan diet is that it can contain dairy products, and one of the nutrients that many people don't get enough of, or two of the nutrients people don't get enough of, are vitamin D and calcium, and those are found in many milk products. So there is that advantage. But for anyone following any of these diets, it's important to actually assess what you are eating, perhaps work with a nutritionist or your physician to make sure you're not becoming deficient in vitamins such as vitamin B12 and several other nutrients as well.
So B12 is only made by animal. It's an animal protein product.
That's right.
You don't get it in any vegetables,
Yeah.
and therefore, I've had problems with patients that get so into their style of eating that they forget
Well,
that there might be some problems there.
Well, B12 is an interesting nutrient because not only is it only naturally found in animal foods, although there is a modest amount in things such as brewer's yeast or in certain fermented foods such as tempeh, a fermented soybean food. So you could potentially get some B12 from there. But as we age, we don't absorb B12 nearly as well. And the current recommendations say if you're over the age of 50, the majority of your B12 should come from the form that's in dietary supplements or fortified foods such as breakfast cereals.
All right, we're still going on the tempting terms here. Organic versus non-organic. Is it worth it?
So organic is very good for the environment, and it definitely will have less pesticides. And that's really important for the foods, the fruits and vegetables that we eat the skin. So on a grape, you definitely might have more pesticides than, say, if you're eating an orange where you peel the skin. That being said, if we're actually looking at the nutrient composition, and so what's in the food, the research has shown that there is no difference between organic foods in terms of the nutrition that's in there compared to the non-organic foods. So that's one where you really have to kind of consider what you want to do and how much you want to spend on that. There are choices though. Oftentimes you can go to your local farmer. They may not necessarily be organic because there are some requirements that can be a little bit difficult and costly to achieve, but you can ask your local farmer how they how they grow their food and how it's kind of prepared, and see if what they do would be more of a sustainable option that has less pesticides, if that's something that you want to try.
It's really a case of what isn't in the food as opposed to what is in the food, because the nutrient content of organic foods really don't seem to be different. I would just add that the evidence that eating organic foods doesn't really add up to being healthier or living longer. There's really mixed evidence that it's actually good for us in the long term. I don't think it's bad for us. If you can actually consume organic or more naturally produced food, and it doesn't impose a burden on your pocketbook or wallet, then I would encourage it.
I would add, having a CSA locally, that there are more varieties on the organic foods. They're using a different blend of fruits and vegetables, so that it does improve the mix of your foods.
Exactly. You typically will try different fruits and vegetables and eat more from the rainbow, as I said earlier. So it can be a great option.
You two seem to know what a CSA is.
Oh, I'm sorry. Community-supported agriculture, so it's locally grown. I'm sorry.
So you can go there and you can
Thank
get a
you for
membership.
Ed, you should be on this side of things here. Probiotics. What's the fuss over bacteria?
While probiotics are another hot topic, because we're seeing that the bacteria in our digestive tract, especially the bacteria in our colons, may predispose to certain conditions, such as high blood cholesterol, or blood sugar, or obesity, or even Alzheimer's disease. Now, this research is in very preliminary stages, but the composition of the bacteria in our colon actually differs between people who are overweight and people who are not. So I think there's really something to this. Now, probiotics are bacteria that we consume, and when you're consuming probiotics, it changes the bacteria in your digestive tract. There are some that may have an effect on your digestive health and how well you move your bowels, and there are also some that may have a benefit on some of these other more chronic conditions. But the evidence for that is really not in yet. I don't think there's anything wrong with consuming probiotics, especially in the form of, say, yogurt or other dairy products that are fermented that have live bacteria. And if consuming a probiotic such as lactobacillus helps you feel better, I don't think there's much evidence that it would actually harm you unless you have an impaired immune system. But beyond that, I think that it's very hard to routinely recommend probiotics.
I agree, and you can find probiotics. So if you look on the back of a food package like yogurt, you'll see that it says live active cultures by the ingredients list, and then that's how you know that it'll list the cultures, and that's how you know if it is a probiotic and has that good bacteria.
Now, I often prescribe probiotics for folks who have just been on a course of antibiotics.
Right.
To help them repopulate, and certainly there's a lot of research that some of the antibiotic-induced diarrheas are now helped by giving a course of probiotics. So we're on the cusp of some real research here.
That raises a very important point, in that for certain nutrients, sometimes we need to take certain doses, or doses that we would that are higher than we would normally consume. And in the case of repopulating the good bacteria in your intestines after antibiotics, I think it's a very appropriate use. What I think we're mostly talking about in terms of being cautious is whether or not we should routinely consume them on a regular basis for an indefinite period of time, because there might be longer term health benefits.
So this is back to our theme of everything sort of in balance and in moderation, so that if you're eating something, you don't want to just have a strict bread and water diet or whatever.
Well, it also reminds me that as physicians, we sometimes feel a responsibility to rely on evidence that's available to us in our medical journals and in other means. And it doesn't mean that there might not be beneficial effects. It's just that we have a responsibility to be relatively conservative about what we're recommending, because we certainly don't want to do any harm. What you recommend to your family or your friends, not as a physician, may actually be different, and that's based on your personal experience and not as being a caregiver for patients.
Okay, since we're on a roll, genetically modified organisms.
So
it seems it's huge in Europe.
It is. It's definitely a hot topic. In terms of nutrition, though, there isn't much research out there in terms of the nutrition component of it. So their genetically modified organisms don't differ as far as we know from ones that aren't genetically modified, unless they're doing it in a way where they're trying to find something that's higher in whatever they're modifying. So if you're looking at it from just a nutrition standpoint, it's safe to consume genetically modified foods compared to others.
It has the same amount of protein, same amount of fat, same amount of whatever.
For generally, unless they do something to change it.
And there are different reasons that people have tried to genetically modify food. Some foods have been modified to protect against pests or other blights, and so that it increases the yield of food. And in some cases, the ability to actually produce a nutrient that doesn't naturally occur in a food has been created by inserting a gene into that food. And some of those products have been used in parts of the world where there's malnutrition, so that people can grow something that contains a nutrient that is deficient in the diet. So I think that the intention of genetically modified foods is a very good one. However, there are some concerns that the genie may get out of the bottle, if you will, and it sounds, some people create this science fiction scenario where these organisms are going to take over naturally occurring crops. And I don't know if that's realistic or not. Certainly in Europe, that's more the attitude. But we've also been modifying our foods, genetically or otherwise, for centuries. Gregor Mendel, who was really the father of genetics, started by mixing and matching peas.
And
yeah.
So that was the first genetically modified organism.
Yep.
But antibiotics in food.
So there is a concern that when antibiotics are added to food, and these are usually animal foods, and when they're added to animal feed, what it can do is decrease the risk for certain diseases that occur in animals, or actually treat certain diseases. Current thinking is that it is safer to use lower doses of antibiotics, so that essentially we're just suppressing certain diseases that could be a problem in animals, and this may actually prevent some foodborne illnesses as well. But the risk is that you create antibiotic resistance. And when you create antibiotic resistance, the antibiotics that we normally take for infections may not work. And if they don't work, then some serious problems can result. So in general, decreasing antibiotics in food is a good thing, although there are some concerns about what the yield of farming would be if we eliminated antibiotics altogether.
Okay. Multivitamins, are they worth it? Amy, why don't you take that?
So theoretically, from a healthy diet, if people are consuming, again, that balanced diet, they should be able to get all of the vitamins and minerals that they need. There are a couple of exceptions, especially with aging, and vitamin D2 is one that it's hard to get in foods, and again, that's another one that's on this food label that they have now added. So we can look at our vitamin D content. It's down in the bottom right by potassium, so we can see that as well. But in general, most foods we can get from a balanced diet, and usually it tends to be a bit more bioavailable, and what that means is our body is better at absorbing the food, and we don't exactly know if we're getting it in a supplement form, and it may not be as easily absorbed as when we consume it in that food form.
So, the more stuff that they have in a multivitamin is not necessarily better. If you had to take out what you really needed from a multivitamin, what would you give us?
Well, that's a really tough question.
Oh, sorry.
So the current controversy about multivitamins really has arisen in the last year when the medical literature included some recommendations that multivitamins don't necessarily improve health. And this report actually involved multiple studies. And some people agree with it and some people don't. But here's the problem. People who take multivitamins, and over 50%, about 53% of adults in the United States have used a multivitamin or dietary supplement in the last 30 days. So they're very common. But people who take multivitamins are also the ones that generally have healthier diets and exercise more and maintain a healthier weight. So it's the people that actually don't need them who are consuming them. Having said that, most Americans don't consume what we consider the ideal amounts of most nutrients. And so you could justify taking either a basic multivitamin or consuming fortified foods to meet those nutrient needs.
Wow. That's impressive. Let's move on. Vitamin D, is it worth it?
So vitamin D we commonly refer to as the sunshine vitamin because we can absorb it through our skin from when we have exposure to the sun. So, this is kind of another newer vitamin that we've been looking at, and they have found that low vitamin D levels are running rampant in the United States and in other countries as well, and that there may be some associations to other health risks. So it's a good idea to get your vitamin D levels checked and then see if you do need to increase your intake, whether it's through food or through a supplement.
Or sunbathing.
Or sunbathing. However, if you have darker skin...
But then we get the dermatologist giving us grief.
Yeah, you have to be careful. It's definitely a balance. And if you're older, you're not as able to absorb the vitamin D. And if you have darker skin, it is more difficult for your skin to convert it into that vitamin D that we need.
You need a fair amount of skin exposed.
Well, actually, that's a myth. That's a myth.
It is.
Yeah, because so in the summer, at least, in a place like Massachusetts, if you expose either your arms or legs to sunlight for 10 minutes a day, you will make adequate vitamin D from your skin.
But the sun has to be a certain height in the sky.
So between, say, November and May, you can spend your entire day sunbathing outside and you won't make vitamin D at all. So that's when we really need to consider if we should be getting our vitamin D from fortified foods or supplements. Now, the other concern or issue about vitamin D is that some investigators think that it has roles in the body other than the ones we have normally associated with it, which is maintaining calcium and strong bones. And some people think that some types of cancer or diabetes or responses to certain infections might be responsive to vitamin D, and there's a lot of research currently being conducted to look at that.
So the bottom line on this is check your vitamin D at a certain age, and if you're not going out into the sun at all, and make sure that you've got adequate amounts.
Well, I think the bottom line is to consume, the recommended levels, and if you're concerned about your levels or you think you should be taking more, discuss this with your physician, and a blood test can answer that question.
Beautiful. Superfoods. Are they really super?
So I think there's a lot of superfoods. And there's definitely ones that are in the press, as we kind of mentioned earlier, that get a lot of publicity. However, and they typically are a superfood because they are very nutrient dense and again contain a lot of nutrition in that little food. So they're definitely a great thing to consume, again in moderation. I mean, we need to make sure that that's not the only thing we consume and we go crazy with kale or chia seeds. Too much is too much. But superfoods.
Well, we only have about 3 minutes left, believe it or not. So what I'd like you to do is just maybe sum up, give us a typical good diet for either of you. And then we're going to have to close, unfortunately, unless we do a third show.
So we mentioned in the last show about the plate method, and that's a great way to get a balanced diet. Again, just to review, it's taking a plate, splitting it in half, and filling half that plate with fruits and vegetables. A quarter of your plate would then be the meats or the proteins, and then a quarter would be the grains and the starches, and then a serving of low-fat dairy. And having that 3 times a day, depending on your needs, some snacks in between, can give you kind of a balanced diet. But bottom line is really try to eat your fruits and vegetables and your whole grains, choose lean protein, and try to choose low-fat dairy products.
Ed?
I would.
What do you like to eat? What does your day look like?
Well, what I do eat and what I would recommend sometimes are different.
Are not necessarily the same.
But I agree with Amy 100%. I think that we also should try to consume as minimally processed food as possible. And that's not always possible, but at times it is. It also may require more preparation and planning. But I think that the long-term health benefits are worth it. You'll potentially have better health outcomes. You'll feel fuller. You'll have less problems with rapid hunger returning. And I think that a more plant-based than animal-based diet is one that can be recommended. Whole foods, fruit and vegetables, whole grains, decreasing our added sugars. Sweets on occasions are fine, but maybe not routinely. Minimize. Yeah.
You two have been wonderful. It's been a while since we've had to break a show up into 2 in order to get all that our guests have to offer. I'm sure you have even more, and we could go on for a long while. But I thank you too, Dr. Ed Saltzman and Ms. Amy Taitch. And for more information about food and your health, and to view part 1 of this program, as well as past physician-focused programs on a variety of health topics, visit our website at physicianfocus.org. I'm Dr. Bruce Carlin. Thank you for watching.
I'm Dr. Ed Saltzman. The amount and kinds of foods we eat have an enormous impact on our health. Foods with high levels of added sugar, salt, and sometimes the fats, along with limited physical activity, may lead to high rates of obesity. That in turn can lead to chronic conditions such as diabetes and heart disease. Healthy eating promotes good health and reduces the risk for chronic illness. Here are 4 tips to get you on the right track. Watch your calorie intake. The formula is simple. The more calories we consume without physical activity to burn those calories, the more weight we gain. Eat more nutrient-dense foods such as fruits, vegetables, whole grains, and lean meats. Decrease your consumption of foods and drinks with added sugars. And read food labels when you shop to determine the amount of fat, sodium, sugar you may be consuming. For more information on healthy eating, visit the Centers for Disease Control at cdc.gov.
I'm Dr. Robert Schreiber.
And I'm Jennifer Raymond.
Chronic diseases such as heart disease, diabetes, high blood pressure, and chronic pain are a leading cause of death and disability in the U.S.
Some 90 million Americans are affected by these conditions, and the Centers for Disease Control and Prevention reports that 2 out of 3 older Americans have multiple chronic conditions.
Traditional care of chronic disease has focused on the physician's role in caregiving, but a new model is emerging, that of patient self-management.
The Healthy Living Center of Excellence is a collaboration between Elder Services of the Merrimack Valley and Hebrew Senior Life, a medical provider with a goal of helping seniors remain independent and in the community as long as possible.
By combining expertise in the aging and medical networks, the collaborative offers a variety of programs throughout Massachusetts that encourage older adults to become partners in managing their health.
For more information on how you can participate, visit healthylivingforme.org or call 1-800-892-0890.